everyone. Welcome to the Leela channel. I'm Star, a member of the Leela team, and I'm so excited to be here talking with Dr. Navya Mysore again. This is our second video featuring Dr. Navya Mysore, or Navya as she goes by, and today we're going to be discussing pregnancy and the medical field. So if you haven't seen the first video, I really encourage you to check it out. It's a very informative video where she shares a lot about her kind of personal approach to treating pregnant and new moms. So definitely go check that out if you haven't yet. Navya, thanks so much for spending some more time with us. And to start, we just wanted to ask you, what should pregnant women look for when choosing an OBGYN?
Yeah, thanks for having me again. Definitely, this is a really important question, and so many of my patients ask me about this, and I really think it is truly important to spend time at the beginning to find the right OBGYN. There are a few things to take into consideration. So, one, are they covered under your insurance? And what is your budget in terms of paying out of network if you are going to be paying out of network? Two, proximity to your home or work. Three, is it relatively easy to contact them if you have any questions as you sort of progress into the pregnancy? Four, do you prefer a male or a female physician or provider? And then five, which hospital are they affiliated with? But really, I would say like these are sort of the more logistical things that you need to sort of think about and what's important for you specifically. But at the end of the day, I really think it's important to find someone who listens to you, who isn't rushing you out the door, where you feel comfortable at every appointment, and really takes the time to answer your questions. And so that allows you to feel safe when it comes time for your delivery.
Thank you. So what advice do you have for pregnant women in establishing good relationships with their doctors and, things like how can they advocate for themselves in the doctor's office and what kind of questions should they ask?
Yeah, totally important, and I can attest to this actually with my own pregnancy. But I always tell my patients to not to hesitate to make a few first appointments with a few different OBGYNs to really see what their bedside manner is like and whether you feel comfortable with them. This is a really good way of sort of assessing a healthcare provider's style and whether it's a right fit for you. And one fit that would fit with your girlfriend might not necessarily work for you. So it really is about sort of seeing if you feel comfortable with them and it's the way that you would feel like you want your pregnancy to be followed. Don't hesitate to come with a list of questions and to ask them a few of them at that first visit. It really is a nice way, again, to establish that doctor-patient relationship and to understand what it's going to look like moving into the future. And some of those questions could be like, who would deliver me? Who should I call if I have any questions or concerns during my pregnancy? Um, if they're part of an OB group, then will you get a chance to actually meet all the OB-GYNs during the course of your pregnancy? And leading into obviously who would deliver you. And then fourth, like what is their opinion about having certain amount of support during the delivery itself? And that could be in the form of a doula, that could be in the form of having maybe a squat stool or a pull-up bar or anything that might help during the labor process itself, and just to sort of see what are they amenable to or what are they comfortable with. And again, your personal preferences will come into play here. So not everyone is going to want to have a doula, and that's totally fine. But making sure that if these are things that you are considering, to see if your healthcare provider is open-minded to these things, I think is important.
Yeah, for sure. Especially since I think asking the right questions these days to your doctors is so important because there's so much information on the internet about everything. So, on that note, how can pregnant women safely navigate the vast amount of information on the internet about pregnancy?
Yeah, there is a ton of information out there. Some sources are really great, but there are so many that have just a ton of false information. I often say that if you're worried about any new potential research that may have come out, or something that you've read on the internet that may apply to you, really come prepared for that next appointment. Write down the questions, or maybe even bring the source or print it out, or whatever it may be of what you've actually read, so you can go in prepared for your appointment. And that way, you're your healthcare provider, your OBGYN, or even your primary care, if you're seeing your primary care, whoever it may be for that visit, will be better equipped to help you answer those questions and take the time that they need to make sure that things are clarified.
Yeah, and so I guess in a similar vein, it's important to like make the right decision with the right kind of information. So, what advice do you have for pregnant women when it comes to actually making those medical decisions?
Yeah, clinical decisions are hard to make, right? And I think that having that relationship, that strong relationship with your healthcare provider is so important for that reason. And we call it, like, we have a term that's called shared decision making. And it's really about a process that you work through with your healthcare provider in terms of balancing the pros and cons of each medical decision. Um, and from the provider aspect and from the patient aspect, right? Because you guys might have differing priorities. And I think it's important to for the both of you to understand what those priorities are so you guys can meet on the same page. The Your obstetrician may lay out some data or evidence, but I think it's also important to follow up with how you feel about that information, and what are some of your personal drivers in terms of making those decisions. An example I can give, like, for example, is uh, would you like to, like, if your pregnancy is continuing and you haven't necessarily gone into labor, what is the plan for induction, and when would you like that to be, and how would you like that to be? So then there's multiple examples like that in pregnancy. I could go on and on, but that was one of my personal clinical decisions that I made with my obstetrician. Was my pregnancy went till 42 weeks, and I really did not want to have an induction myself. And so it was really about deciding with my obstetrician how far are we comfortable letting this pregnancy go. And really where we met was at 42 weeks. And the day before I was supposed to go in for induction, I went into labor. So um, all in all, it ended up sort of the way that I had wanted it to be. But I definitely can say that having that shared decision conversation with my obstetrician was very helpful.
Yeah, thank you for sharing that. So I guess, do you have any recommendations for where to find resources during your pregnancy to learn more about how to take care of your health and well-being in a more holistic way?
Yeah, taking care of your mind, your body is so important. It's important for every part of your life's journey. Not, obviously, especially in pregnancy, but not precluding just pregnancy, right? So even preconception, postpartum, afterwards, also just everyday day-to-day life, like from hydration, your diet, exercise, sleep. It's really good to have those resources that you can rely on and look for guidance. One that I really like is the Mayo Guide to Pregnancy, or it's the Mayo Clinic Guide to a Healthy Pregnancy. I think it's a great book. It really sort of goes through the gamut of kind of symptoms that you could possibly have, things to look out for, how to make sure that you are, treating your body the way it needs to be treated. And then obviously, I think you're having that, again, that strong relationship with your OB-GYN and using them as a source of information or asking your questions. That's definitely a great source to go to. If you have a good primary care as well, like, I often will have a lot of my patients who have their obstetrician, but will also come to me for their primary care during their pregnancy to ask me other questions that they might not necessarily have had a chance to necessarily review with their obstetrician because they're so focused about the pregnancy per se. And that, I think, is also a great place where you can get some information. If you are considering a doula, I think that's a really also a great resource to have in terms of answering your questions regarding like diet, exercise, how to move during your pregnancy. And then the last piece that I found really helpful for me was this book called Expecting Better. It's written by Emily Oster, who's an economist, and she's has done a really wonderful job of gathering a lot of the evidence-based data regarding sort of key elements of the pregnancy, divided into the trimesters, so first, second, and third, and really like lays it out there. So it's helpful for you while you are reading through this and trying to make some of those more heavy clinical decisions, and can be a tool for you to have when you go in to talk to your obstetrician or your gynecologist.
Well, thank you for sharing all those with us. That's so great to hear all those different resources coming from a doctor. So thank you. Yeah, and just thank you for taking the time to share all of your expertise expertise with us today. It's been so informative and I'm sure so helpful to everyone watching. Thank you to everyone out there watching. And like I said before, be sure to check out our other video featuring Navya. And also be sure to follow Navya on Instagram. It's at Dr. Navya Mysore, so dr.navya Mysore. And we're going to put that up on the next screen as well. But yeah, thank you so much for being here with us today.
Thank you for having me. And if anyone has any questions or regarding anything, please feel free to DM me on Instagram. Again, that's dr.navyamysore. Yeah, I would love to answer your questions if you have any, so don't hesitate. Thank you for having me.
Of course. Thank you so much. Bye.
Bye.